So biofilm, you'll find that the bacteria is floating in the saliva. So you have a parotid gland and then you have the glands under your tongue. So the more common places to find tartar is right here in these molars and right behind the mandibular anteriors. So the bacteria is floating in the saliva, and after 24 to 48 hours, the bacteria, which we call plaque, now turns into tartar. And the most common places to find the tartar on your maxillary molars and your mandibular anteriors on the lingual side. That's where we're most commonly finding on patients. And the more saliva that you have, the more tartar usually that you see. And that's the first way that I identify it, is you can visually see it in their mouth, that it'll be in these areas right here. We take a ultrasonic tip, which is the cavitron, and we go around and under their gum and we remove it, or we can manually remove it with a Gracie or a sickle. So on patients that I see a lot of tartar buildup, I'll tell them that they need to focus more on these areas and this area. And a lot of times, a lot of people will miss this area because the way they're brushing, they've learned to brush this way. So I tell them that they need to brush vertically in this direction, and on these to make sure they go part way on the gum, part way on the tooth. Using an electric toothbrush helps a lot too. They're twice as effective as using a manual toothbrush, because I'll see that people that use manual toothbrushes miss these areas a lot. And flossing too, flossing in the C-shaped floss. So you wrap around the floss on your fingers and then go down into the gum line, wrap around the tooth, go down into the gum, and then come out, and then go down into the other side of the gum and then come out.